Which of the following statements regarding the flat foot are true? 1, 2, 3, 4. All are true. All children below 3 years have flat foot. 15% adult have flat foot. Painless flexible foot need no treatment. Rigid flat foot is a result of tarsal coalition. All of the following are cause of acute red eye except acute macular edema. All are true about vernal conjunctivitis except most signs are in lower lid. Preoperative Samsoon and Young modified Mallam putty test is used for assessing difficulty in intubation. In split thickness graft, which part of the skin are included? Epidermis and part of dermis. Young boy riding a motorcycle met with a road traffic accident. On examination, he had maxillofacial trauma with paresthesia of the lower lip. Most likely underlining, he has fracture of the mandibular body. A 20-year-old patient underwent open hernia surgery 4 days back. He is running fever for the last 1 day, and on local examination, the operated site was wet with pus and surrounding redness and edema. The appropriate management would be opening suture and cleaning of wound. Good surgical practice and surgical ethics include all except experiment. Refeeding syndrome, seen after enteral or parenteral nutrition, is characterized by all except hyponatremia. The capillary refill time is prolonged in all type of shock except septic shock. Which of the following is not the hormonal basis for hyperemesis gravidarum? Excess of human placental lactogen. Consider the following statements regarding pregnancy with Rh isomerization. All the given statements are correct. Indirect Combs test is performed in mother. Methigrin is withheld at delivery of anterior shoulder. Middle cerebral artery peak systolic velocity is an accurate method to predict fetal anemia. In fetus with spina bifida, which of the following signs may be seen on ultrasound? Lemon sign, banana sign, defect seen in vertebral bodies or tissue overlining it. In pregnancy with Down syndrome, correct statement is beta HCG is raised. A 25-year-old G2P1L1 Rh negative woman presented at 30 weeks gestation to the antenatal clinic. The indirect Combs test ICT was found to be positive. What would be the next line of in management? ICT titers to be closely monitored at weekly intervals. Given below are obstetric maneuvers and their indication, which of the following is correctly matched? Ridgen maneuver, controlled delivery of fetal head. The maternal serum alpha fetoprotein level is elevated in all except Down syndrome. Which one of the following statements regarding Bartholin glands is not true? Duct opens at the junction between anterior 1/3 and posterior 2/3 between hymen and labium minus. An 18-year-old unmarried girl comes with complaints of heavy, prolonged bleeding during menses. Which among the following investigation is not usually advised? Dilation and curettage. Which one of the following is true about basal body temperature? Biphasic pattern, increase in the level of progesterone and norepinephrine. Consider the following statement regarding infertility. Endometrial biopsy provides information regarding ovulatory factor. Both tubal and peritoneal factors can be assessed by laparoscopy. Unexplained infertility may be due to luteal phase defect. All statements are correct. Which of the following about primary dysmenorrhea is not true? Pain increases following pregnancy and delivery. Consider the following statements regarding diameters of a normal female pelvis. AP diameter is the shortest diameter at brim. Which of the following is not a characteristic clinical feature of bacterial vaginosis? Thick curdy discharge. Which of the following are vaccines for prevention of cervical cancer? Cervarix, Gardasil. Consider the following statements regarding carcinoma cervix. Clinical staging is done. Treatment if provided in stage 1 lead to survival rate of 80 to 90%. HPV virus is considered to be the causative agent. Which one of the following is not a mandatory procedure for FIGO staging of carcinoma cervix? Ultrasound abdomen. Consider the following statements regarding uterine leiomyoma. Prevalence is highest between 35 and 45 years. More common is nulliparous woman. Display reversible shrinkage after treatment with GnRH. Requires to be treated only if symptomatic. A 58-year-old woman with suspected ovarian cancer was operated for surgical staging. On laparotomy and subsequent histopathological examination of the specimen, it was found that both ovaries were involved. Capsule was ruptured. Ascites was present containing malignant cells. Uterus and tubes were normal and there were no peritoneal implants. The FIGO stage for this patient would be stage 1. Which one of the following is the serum marker in epithelial ovarian cancer? CA125.